Well, let's turn our attention to the latest developments on the coronavirus. Three U.S. senators now saying they have tested positive for COVID-19. Senator John Hickenlooper out of Colorado, Senator Angus King, and Senator Roger Wickers all saying they contracted COVID-19 despite being fully vaccinated. All this comes as new data out from the CDC shows more Americans are opting to get the vaccination in the face of rising cases. The agency saying more than 1 million doses were administered on Thursday. That is the highest number in more than a month. And of course, we're seeing this as states in the South are reporting hospitals operating at near capacity. For more on the latest developments, let's bring in Dr. Ellen Eaton. She is with University of Alabama's Birmingham Division of Infectious Disease. She's an assistant professor there. Doctor, it's great to talk to you today. Walk me through what it is you're seeing in Alabama. We've seen the numbers in terms of hospitalizations up nearly 60% over the last 14 days. What have you witnessed?
Yeah, it's pretty overwhelming here. We experienced a lull this summer, May, June. Our hospitals started clearing out. We were able to resume those services that we know are so important, procedures that may be elective but are still critical for our patients. And then with August, we've really seen the Delta variant pick up. We've seen it pick up with children, young adults, young women, pregnant women, unfortunately. And as cases have risen, we've also unfortunately seen hospitalizations and deaths. And we think it's going to get worse. All objective data suggests it's going to get worse before it gets better. Our cases continue to hit record levels day after day. Again, a different group, a younger group, a previously healthy group, and mostly an unvaccinated group.
Can you tell us how this compares with the period of more than a year ago, maybe the height of the coronavirus pandemic early on? And then in terms of the people that are coming in, are they as sick when you say they're largely unvaccinated? If they are vaccinated, are the symptoms milder? Can you just kind of give us a boots on the ground look at what's going on there?
Absolutely. I was on service in December, late December, early January of last year. And it was very grim. Our ICUs were full. There were, floors and floors of intubated patients, prone patients. I will say most did not have access to the vaccine. They were older. And if they weren't older, most of them had comorbid conditions. The average age being older, 60s, 70s. And certainly this group that we're seeing now is younger. They are, as I mentioned, mostly unvaccinated. If the average age is in the 50s to 60s, that still means we're seeing 20 and 30-year-olds, in addition to some 70, 80-year-olds. The patients are definitely sicker. I'm an infectious disease doctor, but my ICU colleagues who are critical care trained tell me the number of young patients who are prone, which is a position that they need to be on for ventilation to adequately ventilate their lungs. It's a very high demand position, requires lots of nursing staff, but the number of young individuals who are requiring this level of care is really unlike the prior surge, which was really a totally different demographic pre-vaccination. And now, fortunately, the good news is that a lot of our older patients and neighbors have gotten vaccinated. The 65 and up group in our community, we're seeing a really good turnout for vaccinations, and we're seeing a lot of them stay home. When they do get a breakthrough infection, it's a cold or a flu type virus. For our unvaccinated young parents, 20, 30, 40, 50-year-old, who's unvaccinated, the Delta variant is much more severe in them. We're seeing them come in sooner. We're seeing them require life support ventilation, even ECMO. And this has also been the case for our pregnant women. I think if there's ever a group who's thought of as young and healthy, it is pregnant women, right? They're in the peak of their life. The fact that they're able to get pregnant usually suggests they're healthy. They often have young children at home. We have seen a significant uptick in pregnant women. In August alone, we've seen 39 hospitalized pregnant women at our hospital, which is much more than in December or January or any prior surge at UAB. Of those 39 women just this month, we know that 10 have had to be in the ICU, 7 have required intubation. So I think that just shows that this is a different virus. It's a different demographic being affected. And unfortunately, it's an unvaccinated group that's being affected.
Doctor, how many of those young patients that you're seeing are under the age of 12 and cannot get vaccinated? And there's a lot of questions about just how severely children are affected by COVID-19. What are you seeing specifically in your hospitals?
Yeah, so I don't work in our children's hospital, but we do have close communication with our pediatric colleagues. They're definitely seeing double digits, and they're certainly seeing numbers that they did not see in December and January. They're seeing numbers that are much higher. Certainly, some do have medical conditions. They're young, they're robust, but they may have medical conditions. But then there are some that are under 2 who are requiring intubation who do not have medical conditions. And that is, frankly, as a parent, I have a 6 and 8-year-old who are unvaccinated, too young to be vaccinated. That's very scary to know that the level of community spread in my community, in the schools, is frankly a huge risk factor for my unvaccinated children. And our pediatric colleagues are seeing the same thing in their clinics and on the wards in the children's hospital.